Hello, and today we're going to be doing our medication demonstration test off. We're going to start by showing the camera our front and back of our MAR and our patient scenario. And then we're going to scan the room. I'm going to show you my desk. And then underneath my desk, and the floor around it. Okay, so let's get started. First I'm going to tell you the six routes, or the 6 rights, the patient's 6 rights. It's the right drug, the right dose, the right patient, the right time, the right route, and the right documentation. Next I'm going to do my medication reconciliation. I'm going to be looking at the doctor's orders and comparing it to the MAR and making sure that there's no duplications, omissions, or contraindications. We're doing this to ensure the patient's safety because we always want to protect the patient and keep the patient safe. The next thing that we're going to do is we're going to state whenever we do the 3 medication checks. The first one is going to be while we're getting the medication. The second one is going to be while we're preparing the medication, and the third one is going to be at the patient's bedside whenever we have already entered the room. So I'm going to go ahead and start my first medication med check. So I'm going to grab my furosemide. I'm going to look at the MAR. And so we have a furosemide 60 mg PO available, 60 mg tab, give 1 tab PO BID. We're looking at our furosemide. So we have furosemide, 60 mg tab, 60 mg tab. And this expires 6/23 of 2020. That's correct. We're going to pick up our aspirin. We're going to compare it to the MAR. We have aspirin, 81 mg per tab, available 81 mg per tab. We're supposed to give 1 tab PO daily, and this expires 5/26 of 2020. That's the right medication. Next, we're going to have hydromorphone, 2 mg intramuscularly. Available, we have 2 mg per milliliter. We're supposed to give 1 milliliter intramuscularly every 46 hours as needed for left foot pain. We're going to grab our hydromorphone. We're going to go hydromorphone, 2 mg per milliliter, 2 mg per milliliter. This expires 5/26 2020, and that is the right medication. The next one that we're going to be doing is the tuberculin PPD 5TU intradermal. Available, we have 5TU / 0.1 milliliters. We're supposed to give 0.1 milliliters intradermal today. We look at our vial and we compare it to the MAR. PPD skin test. 5TU / 0.1 ml. 5TU / 0.1 ml. Intradermal. And so this expires 6/23 of 2020, and this is the right medication. Next, we'll be doing our MPH. Even though this isn't due until 2100, we're going to go ahead and put it in the med card. So insulin, NPH, 25 units subcutaneously, available 100 units per milliliter. NPH, available 100 units per milliliter. We're supposed to give 25 units subcutaneously every PM. And this expires 02 of 2028. So this is the right medication that we're supposed to give at 2100. So now we're going to do insulin regular, 100 units per milliliter subcutaneously. We're going to come over here, we're going to grab our insulin. We're going to do Humulin R insulin, regular insulin. 100 units per milliliter, 100 units per milliliter. This is a subcutaneous medication. And we're going to do this per sliding scale ACHS, which just means before meals. We're going to see that this medication expires 6/12 of 2020, and that is the correct medication. So now we're going to go ahead and move on to our second medication check, and we're going to go ahead and call our second nurse over here so that she can verify whenever we draw up our insulin. So we're going to go ahead and start. We're going to perform our hand hygiene. We are going to gather our necessary supplies and equipment. We have our tape. We have our writing utensils. We have our gauges. We have our the right syringe sizes. We have our alcohol prep pad. And then we have our medication cups to put our furosemide in. What the heck? Why isn't this coming off? Okay, and so now we're going to go ahead and start preparing our medications. So first, we're going to do our second med check, and then we're going to correctly put everything where it's supposed to go. So we have furosemide again. So furosemide, 60 milligrams per tablet. Furosemide, 60 milligrams PO available, 60 milligrams per tablet. We're supposed to give 1 tablet PO daily. Okay, and this expires 6/23 of 2020. And that matches. So now we're going to put our furosemide in our medication cup. We're going to put our furosemide in our medication cart for safe transport. We are also going to check the patient's labs for furosemide. We're going to be looking at the patient's BUN, the patient's creatinine, because she's having renal insufficiency. We're going to check the patient's GFR and the patient's potassium. We're checking the potassium to make sure that we do not accidentally give our patient hypokalemia. The patient's labs are showing that her potassium is 3.9 on a scale of 3.5 to 5.0, which is good. Her BUN is raised, and so is her creatinine, and her GFR is sitting at a 45, and it has to be has to be less than 60. So that is good. We're gonna go ahead and move on to aspirin. So aspirin available, we have 81 milligram tab. We're supposed to give 1 tablet PO daily. This expires 5/26 of 2020. And that is correct. We're going to put it in our medication cup, and we're going to put it in our medication cart for safe transport. We're also going to go ahead and check the patient's H&H. We're going to check the patient's platelets. So her hemoglobin is 13 on a scale of 12 to 16. Her hematocrit is at 37% on a scale of 36 to 44. And her platelets are sitting at 129,000 on a scale of 130,000 to 140,000. We're only going to hold this medication if the platelets are less than 100,000. So that looks like it checks out. We're going to do our hydromorphone. 2 milligrams intramuscularly. So we're going to grab our hydromorphone. We're going to check it out. Hydromorphone, 2 milligrams intramuscularly. Available, we have 2 milligrams per milliliter. Hydromorphone, 2 milligrams per milliliter intramuscularly. That matches. We're supposed to give 1 milliliter intramuscularly every 46 hours as needed for PR and left foot pain. We're going to come over here. We're going to check the vital signs. We're going to look to see that the patient is in pain. She's sitting at a 5 on a scale of 1 to 10. It's on her left foot. And it is throbbing. So that checks out. So the next thing we're going to do is we're going to make sure that we are checking the patient's vital signs. So we want the systolic blood pressure to be greater than 100. The blood pressure is 166/88. We want the pulse rate to be greater than 60. The pulse is 79. We want the respirations to be greater than 10. The respirations are 18. Everything looks good. So now we're going to go ahead and prepare our medication. since this would be a glass ampule, we would grab our alcohol prep pad. We would rip it, open it, shove the glass in there. We would break it away from us. We would put it on the table. We would get our 3 milliliter syringe. We would take it out of its container and make sure that it is a clean, sterile needle. We would grab our filtered needle. We would open the package. We would twist that in. Next, we are going to, if this was a real glass bottle, we would drop the medication like this, because you wouldn't want to invert a glass bottle because the medication would just spill everywhere and defeats the purpose. But since this is a vial, I'm going to have to invert it to get the medication out, and this can be tough, especially since this is a filtered needle. I don't know if that has anything to do with it, but it makes it really hard to drop this medication, so I might struggle a little bit. But I'm going to go ahead and drop my 1 milliliter of air to inject it into the vial. But if this were a glass vial, I wouldn't need to do that, because it would just be open. So I'm going to open the needle like this. I'm going to go ahead and put the air in at this time. I'm going to invert my needle, and I'm going to draw out my 1 milliliter of medication. Okay. So next, I'm going to make sure there's no air bubbles, and there's not any. I'm going to take it out. I'm going to take it out of the glass vial. It usually squirts me, so I don't want it to squirt me. Okay, it didn't squirt me. Okay, good. So now we're going to recap our filtered needle using the swoop and scoop method. We're going to throw this in the sharps container, and I'm going to show you that it is 1 milliliter. Next, what we're going to do is we're going to grab our 22 gauge, and we are going to open this without contamination. And we're going to twist it on. And this is a 22 gauge. It is a 1.5 inch needle. This goes in the trash. This goes in the trash. What you need to know about the hydromorphone, it is not a tuner's check unless it is being wasted, and since the glass ampule only came with 1 milliliter of medication, there was no need to have a second nurse check to see if check our hydromorphone. So next, what we're going to do is we're going to get our tape. We are going to label our hydromorphone. So hydromorphone, 2 milligrams IM per milliliter, and this is going to KIT, KITLLANO, Kitlano. Okay, so now we're going to put this on our syringe part of the needle, because we do not want to put it over the numbers, because then we don't know how much medication that we drew up. And this is going into the med cart for safe transport, and so is the vial, so that I can do my third med check whenever I get into the room. Okay, so the next thing that we have is we have tuberculin PPD 5TU intradermally. So we're going to look at our PPD skin test. So we have PPD skin test, 5TU/0.1 mLs, 5TU/0.1 mLs. We're going to give 0.1 mLs intradermal today. This is an intradermal medication. This expires 6/23 of 2020. And that is correct. So next we're going to go ahead and prep our PPD skin test. We're going to clean the top of this vial. This is a multi-dose vial, and so we're going to inject air into it. We're going to get our 1 milliliter syringe. We're going to take it out of its clean compartment. We are going to open it. We are going to have the 0.1 mLs of air, and we're going to inject it directly into the vial. Then we're going to invert. We're going to withdraw 0.1 mLs. And then we're going to make sure that there's no air bubbles. And I see an air bubble, so I'm going to go ahead and get that out of there. Okay, and it's out. So now, 0.1. I'm going to recap my needle using the swoop and scoop method. So swoop and scoop. I'm going to show you that this is 0.1 mLs. And this is going to be labeled. So we're going to label this right now. So this is TBPPD 5TUID slash 0.1 ml. And this is going to KITLLANO. Okay, and then we're going to label that. And we're going to put this in our medication cart. And we're also going to put the PPD skin test vial in the medication cart so we can do our third check here in a little bit. With the TB skin test, we would just check the labs to see if the patient's white blood cell count has been elevated, and it actually is. Her white blood cell count is sitting at an 11. The normal range for the blood count is 4.5 to 10.1, and so that could be an indication of infection. So moving on, we're going to prepare our insulin regular. So we're going to check our insulin regular, or Humulin R. We're going to see that it says Humulin R insulin, regular insulin 100 units per milliliter. We're supposed to give this subcutaneously per sliding scale. This expires 8/12 of 2020. And so that's okay. This is the right medication. We are going to go ahead and prepare our medication. We have called our nurse over so that she can do the 2-nurse check with us. We're cleaning the top of this vial with an alcohol pad. We are going to pull up 2 units of air because this is a multi-dose vial. We're going to open our needle. We're going to inject the air. We're going to invert the needle. We're going to draw up 2 units. So that is 2 units, and there is no air bubbles. We are going to show our second nurse. She comes over. She says, yeah, that is 2 units. And so that's okay. And so we go ahead and take this out. We're going to use the swoop and scoop method. We are going to recap our needle. And we are going to label our insulin. So insulin regular 100 units per milliliter subcutaneously, and this is going to KITLANO. Okay, and so I'm going to label this, and this is going into the medication cart, and so is the vial that it came with. Next, I'm going to show you or actually before I did that, the assessment I was going to do for this medication is I was going to come over here to the glucose. I was going to see that it is 191. That is how I knew how much medication to draw up according to the sliding scale. According to the sliding scale, if she was between 150 and 199, that's how come I gave her 2 units. And so now I'm going to show you how to do how to mix insulins, even though we're not mixing any right now. Since this is NPH, it has particles at the bottom. You want to mix those particles up, but you do not want to vigorously shake your medication. You want to roll this in between your hands and make sure that you got all those particles mixed up really good. And then what you're going to do is you're going to go ahead and call over your second nurse. And you are going to clean the tops of your NPH, and you're going to clean the top of your regular insulin that you're mixing it with. You are going to grab your needle. You're going to, well, it says that she's getting insulin and pH, so that's just going to be my example. I'm going to draw up 25 units of air. I'm going to inject it into my NPH. I'm going to take it out. Well, then I'm going to take it out, and then I'm going to come over here to the clear. I'm going to draw up however much units of the clear I need, and I'm going to inject the air into the vial. Then I'm going to invert the vial, and I'm going to draw up my medication. I'm going to show my second nurse, is this the correct amount? She says yes. I'm going to put my vial down. I'm going to take the medicine out. Then I'm going to get the needle into the cloudy. I'm going to invert. I'm going to show my second nurse. I'm going to withdraw. If I accidentally draw up too much, I'm going to have to start over from the very beginning. But I didn't draw up the wrong amount, and the second nurse says, yes, that checks out. So then I'm going to go ahead and I'm going to swoop and scoop. I'm going to label, and I'm going to put that in the med cart. Okay, so now we're going to do our third medication check. We're going to walk into the patient's room, or we're going to knock on the patient's door. So knock, 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 knock. We're going to enter the patient's room. We're going to introduce ourselves to the patient. So, hello, Miss Kitlano. My name is Destiny. I'm going to be your nurse today. I'm going to perform my hand hygiene. And then I'm going to put on my gloves. Where the heck are my gloves at? What did I do with my gloves? Oh, there they are. Oh, okay. They're just... Excuse me while I untwist my gloves. It's been a long day, and I do not want to start over. I don't want to start this whole video over because I couldn't find my gloves. Okay. Okay. So we're going to pretend these are clean gloves, okay? You did not just watch me unravel these. Okay, so clean gloves after we performed our hand hygiene. So embarrassing. And then we are going to do our third medication check. So now we're going to go ahead and get our furosemide, and we are going to look at it. Again, we're going to do our third check. So here we have furosemide 60 milligrams per tablet. On the MAR we have furosemide 60 milligrams per tablet. We're supposed to give 1 tablet PO 2 times a day. So this expires at 6/23 of 2020. This is the right medication. And put it back in our medication cup. We're going to go over to Miss Kitlano. We're going to tell her, hello Kit. Oh, actually, before that, we're going to identify our patient. We're going to look at her wristband. We're going to say, Miss Kitlano, can you tell me your name and date of birth? And we're going to compare what she says to her wristband, and then we're going to compare it to the MAR. So she says, yeah, my name is Kitlano. My date of birth is 3/23 of 1960. And so I'm going to look. Oh, yeah, that is when she was born. And so that matches. And then we're going to ask the patient if she has any allergies. She says, no, I don't have any allergies. And I look at the MAR and it says that she doesn't have any allergies. So now we have identified our patient and we know it's the right patient. We've identified the allergies. We know she doesn't have any allergies. Then we're going to do our third check, and we already did that. So now we're going to explain why she's getting this medication. So Ms. Kitlano, you're getting this medication because you have renal insufficiency. So what this medication is going to do is it is going to help you pee. It is a diuretic. I'm going to teach you that since this is a diuretic, you need to be rising in stages whenever you go to the bathroom. What that just basically means is you need to get up slowly. So don't just stand up and try to run off because you probably will pass out. This pill is also a water pill, and it's going to make you pee a lot. So every time you need to pee, you need to push your call out, and you need to call us in here, and you need to let us know that you have to go to the bathroom, and we'll help you go to the bathroom. Also, my evaluation with this medication would be that I would come back to the MAR and or I would come back to the computer. I would check the labs after I had given this medication. I want to be watching to see if the bun and creatinine came down, and I want to see if the GFR came up. So I'm going to go ahead and give the patient this medication at this time. I would also be watching for the potassium. I don't want to send this patient into hypokalemia. So just in case, I would have her on a telemetry device to be watching her heart, because a sign of hypokalemia is cardiac dysrhythmias. So I'm going to go ahead and administer this medication to the patient at this time. Ms. Kitlano, here's your furosemide. She takes it out of the medication cup. She takes it. She drinks her water, and after she drinks her water, I'm going to, as a nurse, I'm going to make sure that she did really take her medicine. So I'm going to make sure that she's not hiding it under her tongue or anything. The patient took her medicine. And now I'm going to move on to aspirin. Okay, so I'm going to get the aspirin. I'm going to take it out of my medication cup. I'm going to look at the aspirin. Aspirin, 81 milligrams PO. Aspirin, 81 milligrams per tab. 81 milligrams per tab. That matches the MAR. We're going to give 1 tablet PO daily. So that checks out. I'm going to put it back in the medication cup. What I would be evaluating before I give this medication is the platelets, the H and H, and we already did that earlier. My evaluation for this medication is I'm going to come back. I'm going to make sure that the patient's not having any bloody stools. I'm going to make sure the patient's not having any chest pain. I'm going to make sure that I tell the patient that she cannot be having her 2 glasses of red wine a night, even though she might think it's delicious, but it will mess up this medication, especially since she's going home on it. I want to be sure to make sure that she knows that. I also want to be sure that she knows that she has to report to her dentist if she has, if she's going to the dentist, she needs to report to all of her doctors that she's on aspirin, because this is an antiplatelet and it can make you bleed a lot, so you don't want to go into surgery on an antiplatelet and bleed everywhere. So that's what I'm going to teach the patient. So I'm going to say, Ms. Kitlano, I'm giving you your aspirin now. I'm giving this to you because you have coronary artery disease, and what this basically does is it makes your platelets not as sticky. I am going to teach you that you need to talk to your doctors about being on aspirin, and you also cannot be having your 2 glasses of red wine at night. She says that she fully understands. I give her medication in her medication cup. She takes her medication. I'm making sure that she isn't having trouble swallowing, and I also did that with the furosemide. I made sure that she wasn't having any trouble swallowing, and she didn't. Now I'm going to check to see if she actually really did swallow her medication, and I look in her mouth, and yeah, sure enough, she really did. So I'm going to write that down, that she took it orally, and I also wrote it down that she took the furosemide orally. So next I'm going to do my third nurse check on the hydromorphone. I'm going to grab my hydromorphone. Okay, I got it. So we have the hydromorphone. We compare that to the MAR. Hydromorphone 2 milligrams per milliliter, 2 milligrams per milliliter. We're giving 1 milliliter intramuscular for 46 hours for left foot pain. And the patient is sitting at a 5 on a scale of 1 to 10. We are going to, since we already checked that, we're going to go ahead and teach the patient, and we're going to administer our hydromorphone. But before all of that, we're going to recheck the vital signs. We're going to make sure that the systolic blood pressure is greater than 100, the pulse is greater than 60, and the respirations are greater than 18. The blood pressure is sitting at 166 over 88, the pulse is 79, and the respirations are 18, which is great because they're not underneath, so we can go ahead and administer the medication. So what we're going to do is we're going to teach Miss Lano that we're going to say, Miss Kit Lano, I'm going to go ahead and give you your hydromorphone. It's for pain. I can see that you're sitting on a scale of 1 to 10. You're sitting at a 5, and I don't want you to be in pain. I want to try to manage your pain. I want to keep you as comfortable as possible. But I am going to teach you that this is hydromorphone. It is a narcotic. It's a narcotic. It's an opioid. And what that can do is that can send you into respiratory distress. So I'm going to need you to please, if you start feeling any signs of shortness of breath or you feel like you're having a hard time breathing, please hit the call button, get some help, because one of the symptoms of this medication can be respiratory distress. She says, "Oh, I've taken it 1,000,000 times. It hasn't never done nothing to me." And I say, "Okay, but still remind us that, or still let us know if you do experience anything." She says, "Okay." The patient verbalizes understanding. I'm going to get an alcohol swab. I'm going to tell her, Miss Kit Lano, this is going into your ventrogluteal muscle. She says that's fine. I'm going to swab her ventrogluteal area with alcohol. I'm going to make sure that's real nice and clean. I'm going to put my palm on the greater trochanter. I'm going to point my fingers up towards the iliac crest. Then I'm going to open my pointer finger, and this is going to be pointing towards the anterior iliac crest, and deep within the V I'm going to inject my medication. So I'm going to go ahead and do that. I have my hand on the hand where it needs to be. I'm going to take the cap off of my medicine using my pinky. Oh, okay, we'll pretend that didn't happen. Using my pinky. Okay, now I'm going to go in at a 90-degree angle, and I'm going to inject my medicine. Oh no, I'm going to aspirate. Always make sure to aspirate with intramuscular injections. And then I'm going to, since there's no blood, I'm going to inject my medication. Okay, so that is going into the sharps. And this goes in the sharps too. And now I'm going to massage this medication, because you can massage this medication. And I'm going to throw away my alcohol swab. The other intramuscular injection sites are the deltoid, 3 fingers, and then right below that, and the ventral, no, not the ventrogluteal, the ventrogluteal, the deltoid, and the vastus lateralis. The third one is the vastus lateralis. Okay, so we're going to come back, and our evaluation for this medication is going to be that we're going to make sure that the patient is no longer sitting on a scale of 1 to 10. Our evaluation for furosemide would be if the patient had, if the patient's daily weight had come down, or if the Bunn creatinine had come down, or if the GFR increased, the aspirin, our evaluation, we would have checked the blood platelets to make sure that they're still within range, and we would also evaluate the patient for chest pain to make sure that the patient wasn't experiencing any chest pain. But moving on to tuberculin. Tuberculin is a intradermal medication. So we're going to go ahead and get our vial out of the cart. We're going to get our PPD. We're going to get our syringe out of the cart. We're going to compare it. We're going to do our third med check. We're going to go ahead and do tuberculin PPD 5TU, PPD skin test, 5TU, that matches. We're supposed to give this 0.1 milliliters intradermal today. This is an intradermal medication. Everything matches. This expires 6/23 of 2020. I'll make sure that this is the right medication, and it is. So next, we are going to tell Ms. Kitlano why she's getting this medication. So Ms. Kitlano, you're getting this medication because you reported yellow blood tinged sputum, and also you're a smoker, so that puts you were an ex-smoker for 40 years, and that puts you at an increased risk for developing tuberculosis. And also, I looked at your white blood cell count earlier, and it is increased. It's sitting at an 11 on a scale of 4.5 to 10.1, which usually means that there could possibly be an infection. Also, being a diabetic puts you at higher risk for developing tuberculosis. So this is going into your forearm, underneath your skin. A Wheeler bulb will pop up, and that's just the medication. That's just how this works. I'm gonna come back and I'm going to evaluate this medication by coming back in 48 to 72 hours to make sure I read the test. An indication that the test is negative is that the Wheeler bulb would be gone, but the indication that the test is positive is that the Wheeler bulb will not be gone. And then if it is, I'm going to call the doctor, and he's probably going to order a chest x-ray, but if it is gone, we're not going to do anything. That just means your test is negative, and that's great. You don't want to have tuberculosis. So we're going to clean your forearm. We are going to take off the lid. We're going to throw that in the sharps container. We're going to make sure that our bulb is facing up, and it is. We're going to pull the skin taut, which just means tight. We're going to go in at a 10 to 15 degree angle. We're going to make sure that just the bulb is in. Just the bulb is in. All these things. Okay. And then we're going to inject our medication. The bulb appears, and we take this out, and we throw this in the sharps container. And then we take our alcohol swab and we gently swipe if we need to, but we do not rub this medication into the patient. Also, with the intradermal medications, you do not shove the whole needle into the skin. You just barely shove the tip of the needle into the skin. The other intradermal sites is the subclavicular and in the scapular area of the back. So we're good to go on that. Next, we have our insulin. We are going to grab our insulin out of the cart. And we already verified it using a 2-nurse check. But we're going to make sure that one more time that we have the right medication. So we're going to do insulin R 100 units per milliliter. We're going to look at the MAR insulin regular 100 units per milliliter subcutaneously per sliding scale ACHS. We're going to look at her blood glucose. It was 191. We're going to look at the sliding scale. It says to give 2 units if the patient is between 150 and 199. So that's good. We're going to go ahead and administer this medication. The expiration date of this medication is 8/12 of 2020. We have the right medication. So now we're going to go over to the bedside, and we're going to tell Miss Kitlano. Miss Kitlano, you're going to go ahead and receive your insulin today. What we're going to teach you about this medication is side effect of this medication is hypoglycemia. If you start feeling like you're cold, or if you're clammy, or if you're shaky, or even if you start feeling confused, please let us know, because that is a sign of hypoglycemia. We will do everything we can to get you out of a hypoglycemic state. This is a subcutaneous injection. So can you please tell me where the last place it is that you received this medication? She says, I received this medication in the back of my arm last time. And I say, okay, that's great. We're always going to be changing sites. So I'm going to write that down. I'm going to give it to her in her abdomen. Okay. So, another thing I'm gonna tell the patient is, well, I already told her about the hypoglycemic. I'm gonna make sure that this patient has a meal in front of her before I give her her insulin, so she can go ahead and eat breakfast. Another thing is I'm gonna come back in 2 hours. I'm gonna evaluate how effective my insulin was by checking her blood glucose again to see if she's in between a 70 and a 100. And like I said, I'm going to make sure that she's not showing any signs or symptoms of hypoglycemia. And if she was, I'll give her like hard candy or juice. So now I'm going to take the lid off of this. Well, first, before I take the lid off, I'm going to swab the abdomen. I'm going to stay 2 inches away from the belly button, 2 inches away from any tattoos, and 2 inches away from any scars, and 2 inches away from any stretch marks. Okay, so now insulin is to be given at a 45 to 90 degree angle, but Miss Kitlano here weighs 250 pounds. So, and for her only being 5'3", that means that she's pretty big. So I'm going to go ahead and give this at a 90 degree angle, but if I was giving it at a 45 degree angle, it looks something like this, but I'm giving it at a 90 degree angle. So I'm going to go ahead and uncap my insulin. I have already cleaned the injection site. And now I'm going to give her medication. I'm going to pinch the skin, make sure that all that is pinched. I'm going to go in at a 90 degree angle. If she was skinnier, I'd go in at a 45 degree angle. I'm going to inject my medicine. I'm going to pull out the needle. I'm going to throw that in the sharps container. So all that goes in the sharps container. I'm going to get an alcohol swab, and I'm going to gently wipe, but I'm not going to rub it in. You do not rub in insulin. So now that I'm done administering my medication, I am going to take off my gloves. I'm going to throw them in the trash. I am going to clean up the patient's room. I am going to go to my documentation. I'm going to make sure that I document the route that I administered the drug. So for furosemide, I'm going to document that it was an oral medication. I'm going to document any fluid that the patient drank. On the aspirin, I'm going to document it was an oral medication. I'm going to document any fluid that she took. On the hydromorphone, I'm going to document that I gave it into the ventrogluteal muscle. I'm going to document if it was effective by coming back and reevaluating her pain. I'm going to document that I gave the tuberculin PPD skin test in the forearm, or in the patient's left forearm. And I'm going to come back in 48 to 72 hours to reevaluate if the wheal or bulb disappeared. Then I'm going to document that I gave insulin regular 100 units milliliters subcutaneously in the abdomen. And I'm going to identify which quadrant I had given the medication in my documentation. And so after I document my medication and any fluid that the patient had drank, I'm going to clean up the patient's room. So I'm going to throw away all the trash and throw it away. I'm going to leave the patient's room tidy. I am going to put the bed in the lowest locked position. I'm going to raise the appropriate number of side rails. I am going to set the patient's bed alarm, because I want to make sure that if she does get out of bed, I know immediately so I can come help her, because like I said, she is on furosemide, and so she might get dizzy. She might not remember that I told her to rise in stages. I am going to give the patient her toiletries and her personal items, and make sure that all her personal items are within reach. I'm going to perform my hand hygiene. I'm going to make sure my hands are clean so that I don't leave the room with any potential infectious material on me, like the TV. And I am going to, I think that's it. I'm pretty sure that's it. I'm going to tell the patient if she needs anything to please call us. I had given her call ID already. I instructed her how to use it. And then I'm going to exit the room. And yeah, we've reached the end of our medication administration video. I am sorry it's so long, but I have figured out that I am a slow talker. And I really try to stay within the 20 minutes, but it's just not possible for me. So I hope you enjoyed my video, and I will see you hopefully very soon because I am tired of taking online classes. Oh, it's been a crazy year. Alright, see you later.